Okay, good morning, Chairman. We're live now.
Good morning and welcome everybody to the Adult and Community Wellbeing Scrutiny Committee. Hope you're all well. So first off, I would like to welcome the members of the public who are listening to the audio feed via the County Council's website. And now I'd like to just confirm the members of the committee who are present. And welcome to Nick as well, Nick Harrison, Democratic Services Officer, who has joined us for the first time on this committee. So Nick, if you'd like to call out the names then, please.
Thank you, Chairman. Councillor Marfleet.
Here.
Councillor Mrs. Sneath.
Here.
Councillor Mrs. Cooper. Councillor Fuchs.
Here.
Councillor Kendrick.
Here.
Councillor Mrs. Kiley.
Yes, she's here. She's got a mic on mute.
Sorry, present.
Thank you. Councillor Mrs. Lawton.
Present.
Councillor Mrs. Overton. No. Councillor Reid. I've seen him present. Sorry. Okay, thank you. Councillor Whittington.
Present.
That's it, Chairman. Thank you.
Okay, thank you. Any councillors that missed the slot by having their mics on, speak now, or you're not present at the present time? Okay, so well, I'd also like to welcome Councillor Patricia Bradwell, the Executive Councillor for Adult Care, and Glenn Garrod is here, the Executive Director. So welcome and Happy New Year to you all. Now I'd like to welcome all the other officers present, and I will introduce them at the beginning of the item. So we'll move on to declarations of members' interest. If there's anything that comes up during the meeting that members feel that they must declare an interest in, please don't hesitate to speak up. We'll go to the minutes of the meeting the 25th of November, item number 3. And I'd like to confirm the minutes as a correct record. So can I have a proposer and a seconder, please?
Hugo, Councillor Fowles, I'll propose.
Thank you. Seconder?
I'll second them. Councillor Sneath.
Thank you. And are we all in favour? So I'd like members to raise their hands if they're all in favour. Yeah, I take it we're all in favour by the show of the hands. So thank you for that.
Chairman, just going back one item, just like to give a formal apologies from Councillor Adams.
Ah, right, yeah, sorry about that. I'd seen that. Yeah, so that's good. Thank you. Okay, so we'll go to announcements. Item 4, announcement by the Chairman, Executive Councillor and Executive Director. I just have one announcement that the urgent decision on the community coronavirus testing facilities. Last week, in my capacity as chairman of this committee, I was consulted on whether I considered a proposed decision on community coronavirus testing facilities was urgent. After following the Rule 17 process in the Constitution, I confirmed that the decision was urgent, which enabled the Chief Executive to make the decision on Friday, the 8th of January 2021. I did speak with the leader of the opposition. I spoke with Derek Ward as well and with Martin Hill and all, and it was an urgent decision. We needed to get on to roll out this rapid testing. So and that's a good news story, and that we're on the way. Patricia, would you like to say anything on?
Well, only really to concur what Glenn was saying at the beginning of the meeting. Obviously, we're back in a full lockdown again, back to similar to what we were at the beginning of the year. But I do think this time around, our staff have sort of slid back into the working slightly differently because of COVID. But as Glenn said, and I wonder whether the committee would thank our home care staff and the residential settings. I don't know how we do that. You probably just do it in the minutes, because they really are doing a great job. And I understand we had a briefing yesterday. The home care, we haven't got many people off in with the providers at the moment, and that's a bit unusual. Probably I shouldn't say this, because obviously schools are home learning, aren't they? And usually in school holidays we find some staff have to stay at home to look after their children, but at the moment staff levels are really good in the residential settings as well. Obviously with the vaccine now moving in and moving at pace, probably you would residential providers, and that the staff will be starting to get the vaccine, which will then help to keep the infection down in our homes. I think we've got an interesting agenda today. I know this is an announcement, but you've got a lot of good things on the agenda. The mental health work that Justine's been doing with LPFT, a really good paper moving us forward, and obviously another extra care facility that you're being asked to approve today. So I think although we are in the terrible position of being locked down and COVID's not in a very good place, a lot of infection, we are moving forward as a council with some really good papers today, and I think that's good news for us as a committee, that you are looking at things that are going to really make a difference to our community. Thank you, Mr. Chairman.
Thank you, and yes, I agree. I think we will sort of send our thanks via the minutes, or anybody that's listening, to all those that have been involved over the Christmas period to keep the services going as well as they have been. And I think it is a credit to our team, and everybody involved, on how well we are meeting the demands and the pressures, and without actually, I hate to say it, but in some sense, we're doing it very well without really pressurising ourselves at the same time. So it's the impression I'm getting. Glenn, is there anything you would like to come in and say?
Thank you, Chair. If I can just reiterate Councillor Bradwell's observations, both adult care and public health colleagues have been doing some remarkably good work. We've come through Christmas and New Year as best, I think, as we could have hoped. And as Councillor Bradwell has indicated, we're also not just dealing with winter pressures and the pandemic, we're also making progress against a number of objectives, some of which are dear, I know, to this committee's heart. And to end on a positive note, today and tomorrow, the vaccination programme will commence for home care workers, and some 800 plus home care workers this week will receive their first vaccination. The care homes themselves have already begun the vaccination programme. So on that fairly optimistic note, I'll leave it. Thank you, Chair.
Excellent, that's great news, and I do, and I think we all now know people that, well, I certainly do, that have been vaccinated in the over 80s or the vulnerable, and that are sort of, in some sense, my age. But so it's certainly, the programme is being rolled out and having an impact. So good news. Okay, we'll move on to item 5 then. Mental health universal offer and community-based model. For this, we've got Lorraine Graves, Claire Derbyshire, Rachel Redgrave and Justine Hackney. Justine Hackney to present and give us an update on this. So welcome all of you.
Thank you very much, Chair. I'm going to do a brief introduction and then I'll leave the presentation to Lorraine and Rachel and Claire Derbyshire. Hopefully people can see those officers' roles and responsibilities up on the first slide. I mean, to echo what Councillor Bradwell says, really, this is a brilliant example, really, a good news story of what can be achieved in terms of working in partnership. And this has been a joint endeavour between Lincolnshire CCG, Lincolnshire County Council, LPFT, and also we'll cover in the presentation a range of other partners as well. People know the outcomes for people with mental illness can be significantly poorer than the general population, particularly in terms of for people with severe mental health problems whose life expectancy is much lower than the general population. Quality of life can also be much poorer, and wider outcomes such as employment can also, and access to housing, etc., can also be really difficult. So it is a really, really important agenda in terms of keeping people's mental health being maximised, and we in terms of the demands that there are on the system at the moment, one of the big issues is that demand for mental health services is increasing, and that's both in terms of volume of demand, but also in terms of complexity of demand. And generally, we know that as people's needs increase, then actually the risk of poor outcomes also increases. So that is a key issue, and the challenge in that a lot of the resources that we currently have in the system, and this isn't just in terms of Lincolnshire, this is nationally as well, a lot of the investment that's currently in mental health services is actually locked into institutional care, and from that we include mental health inpatient provision, both out of county and in county, but also residential and nursing care as well. So, you know, lots of demand and increasing demand, but lots of resources tied up into institutional care. And because of that, that historical pattern, there is a deficit of investment in community mental health services, but also the availability of accommodation for people with mental illness as well. That really creates a cycle of dependency, and it is a real challenge. The national policy direction for a number of years really has very much focused on transformation. So the 5-year forward view for mental health, transforming care, which we mentioned at the last scrutiny meeting, and also the NHS long-term plan, all really have a focus on transforming services, and in particular mental health services, so that we can really address that cycle of dependency. And a lot of the focus in terms of the mental health agenda is actually that investment in community mental health services, that front loading, so that we can avoid admissions to institutional care, and that we can keep people healthy and well in the community, and we can respond to them when they do get into mental health crisis. So we've been really good part of the story is that we were at the front of the queue, really. We were very proactive in terms of getting our business cases put forward, very ably supported by Rachel. And we managed to secure some significant resources for investment in our community mental health services in Lincolnshire. We'll go through that in the slides. I mean, the other key thing in terms of the national policy is around integration, and that's very much around how we collaborate and how we work together. And really, whilst we're really pleased with the NHS long-term plans investment, in terms of really delivering proper transformation, we have to be able to be creative and be able to find ways of moving the overall resources that we have in the system to the right places. And that will mean investing in some social care services. It will also mean investing in community services like public health and interventions like the managed care network that we've talked about before, really. So it's just an introduction and a foot in the door, really, in terms of a future paper that I'll be bringing to scrutiny in terms of how we develop those future joint commissioning arrangements. But for now, I'll pause there and I'll hand it over to colleagues. And very much you'll see that the thrust of this is all around maximising independence. Okay, so I'll pass on to Lorraine and Rachel and Claire.
Thanks, Justin. Simon, could you move the presentation on 2, please? And the next one. Thank you. As Justin mentioned earlier, as well as the sort of 3 key stakeholders that are here presenting today, the transformation has been worked up in collaboration with a number of other partners, which we've tried to highlight some on this slide. But we've got an awful lot more stakeholders which we couldn't fit onto the slide. So just to give you some indication of who else is involved in the transformation work. You could move on, please, Simon.
Good morning, everybody. What I thought would be helpful is just to remind everybody and refresh minds on the investment that we've had. With regards to the mental health universal offer, what we wanted to do was make it really clear to people about what services are available for them, particularly at these really challenging times. And I'm pleased to say we got off to a really great footing just because of the investment we've had over the previous couple of years. So the first 2 columns that you're looking at is 19, 20 and 21. So we've had over nearly £10 million worth of NHS England transformation funds in Lincolnshire from rough sleeping, perinatal, individual placement support. Is it supporting people with enduring mental illness into employment, some suicide prevention work. But the one I want to draw your attention to is really around the community mental health transformation in red. Because we were lucky enough to be one of 12 STB sites to be selected nationally to get this funding as an early implementer site. And so what we're trying to do is completely transform our mental health services to create integrated place-based teams that are multidisciplinary, built around our new and emerging primary care networks. So you may remember that perhaps when I presented 12 months ago, I talked about us having 4 pilot sites, and those sites were selected because so that we've got some geographical coverage. So we've had them going in Gainsborough, Lincoln City South, Grantham and Boston. What I'm now going to draw your attention to is the final column. So we're currently submitting bids to secure funding from April to expand that offer to 5 further sites. We've also, last year we secured money for mental health liaison in the Boston Hospital, and we'd like to do the same to have it in Lincoln. And the other exciting thing is around community crisis care. So just very quickly, this is funded the mental health helpline. It's funded crisis nurses in vehicles responding, and it also started to set up some crisis cafes. And what we'd really like to do is expand that crisis alternative offer with a real focus down the East Coast. Now, we've had a vision for quite a long time, and what I'd like to do now is move on to the next slide and play a video which summarises the Mental Health Crisis Care Concordat's vision of how it should look. And this was done 2 years ago. I don't think we've got any sound.
Yes, it's Simon. Sorry, we tested this yesterday and we did get the sound playing. So obviously, I can try and upload the show the slides again, I guess, as a way around this.
Or I can summarise. So the vision was that what we wanted to have is one single point of access with a single telephone number for Lincolnshire that connected and supported people, but then connected them to their communities. And the vision is that we will have community mental health and wellbeing hubs in all of our 14 PCNs. And this is where we're emerging with the community mental health transformation work and the first 4 test sites. And now we're getting more of those coming on board. Perhaps, Simon, we could circulate the link in the minutes, if that's okay, so people can watch it afterwards. Is that all right?
Yes, certainly, yeah.
Circulate it on its own. Don't go for the minutes. Just circulate it after this meeting, please.
Sorry for the technical hitch. Perhaps we can move on to the next slide, please, Simon. Over to Claire.
Hi, good morning. This very complicated looking slide I'm going to try and summarise for you, because I realise in looking at it on my screen you might not be able to see all the wording there. If you'd have seen the video, what it would have demonstrated is a bit of a helicopter view of Lincolnshire's geography, and on the left hand side of the screen there you can see in probably big letters the mental health hub. This connects all of our crisis cafe works with our professionals within LPFT. So previously, when we'd spoken about and we'd listened to the multi-agency crisis care review, actually one of the biggest critiques for Lincolnshire and mental health services was about access. So the whole vision and the objective around this service was to open up access in your communities. So this is within the geography of Lincolnshire, as many crisis cafes and sites as we could manage, connecting voluntary services with professional services and allowing a streamlined, seamless pathway so that our people, our communities, can connect at the level that they need it to. So on the left of your screen, what you're seeing is a diagram of all of our communities together with how we intend to work together. And then what that demonstrates is that people have different levels in that triangle of need. So some of our population will have fairly straightforward needs that might be addressed with a phone call and a chat and some emotional well-being needs, but some actually on the other end of the spectrum will need a different approach and will need our professional services and crisis care. But what we're saying is that actually it shouldn't be a different access route to any of those needs, and whatever the need is, we should be able to direct it accordingly. On the right-hand side of the screen, what we try to depict is the resources that we already have within Lincolnshire to deal with that. So we have our primary care networks in development. Now, you might previously have known these as clinical commissioning groups, or groups of GPs and clinicians working together in communities to offer connected services. And as part of some of those services, what we have is a mental health practitioner in some of those communities. As Rachel mentioned on the slide, those 5 sites that we initially set up as accelerator sites, working directly with our GPs, practice nurses, and also community champions, charitable sector and third sector. What we also have is our professional services working in a more community-focused way. So our community-trained mental health nurses and professional mental health teams of psychiatrists and psychologists working also together with adult social care colleagues in complete collaboration. I'm going to drop down to the box on the bottom.
Claire, just
bottom right. Yeah.
Claire, just one thing. Can you just explain the terminology crisis cafe? Because if you don't watch it, we're people listening on the radio or on the audio, it gives a concept that you go to a cafe to have a chat with somebody and take from there. And I don't think it's quite like that, is it?
I think it's the crisis cafe is a national terminology, and it's unhelpful in some respects, because actually what it depicts is that you'd have to be in crisis to go to a cafe and get some support, and that's not true. Actually, what it's meant to depict is that it's a community environment, which may be a cafe, it may be a food bank, it may be connecting any kind of community hub that we already have in existence, but actually that connects to professional services. Now, where that's been most successful, not just here but also in the rest of the UK, it's where it's literally been a cup of tea and a chat to start a conversation, because that's what we've been told through the multi-agency review and by our stakeholders is the most accessible route to mental health care where there's previously been a barrier or some reluctance to engage. And so it's the starting point, whatever that starting point is. Certainly, I wouldn't label them as crisis cafes and have a sign up that says this is a crisis cafe. In the town, they're largely not named that. In Gainsbury, you'd be familiar with the Trinity Centre and things like that really work. The Bridge in Lincoln, they're community-owned or community functioning centres that are very popular, and they need to own their own name. Does that clarify?
Yes, that's good, thank you.
Okay, I just want to drop down because this is important for two reasons to that box on the lower right of the page where it says community recovery, because this stems from a concept that actually at the same time as responding to urgent and emergency crisis level mental health need, there's also that connection with prevention and an early response to lower level need. And actually that's not just within the NHS professional services and social care, but actually within our existing community resources. So Lorraine mentioned earlier the managed care network. Justin referred earlier to connecting our resources and efforts from community more creatively, and this is really how that functions. So if you imagine we have the Red Cross, and if you think about the C19 response and all of that connected working that we're doing already, this is purely about really working together as a whole host of organisations without limitation to make sure that what we're doing for the purposes of mental health in our communities is connected, and as connected as we can be to support each other to move forward. So a real partnership approach, and supporting that partnership approach to keeping our communities well and responding appropriately when it's needed. So you can have the next slide, please, Simon.
So the first thing that we've done, and that's been accelerated as a result of COVID, has been the establishment of the Lincolnshire Mental Health Helpline. And we sat down with the Mental Health Crisis Care Concordat, which is a group of over 40 partners, to decide and design what was required. And there were a group of principles that we've stuck to, and that's what it needed to be 24/7 and available 365 days of the year. It needed to be a free number to the caller, so there'd be no cost, so it's no 800 number. It needed, callers said that they wanted it to be anonymous if they wish for it to be anonymous. So I'm delighted to let people know that we switched on the helpline early than we thought. It came online in March. We've got posters which we've co-designed with people accessing mental health services, which you can see on the presentation. You will also see that image as well now on the back of buses going around Lincoln. We've got a campaign on Links FM that's running 3 times a day, so that we hopefully have got one point of access that people know where they can get help from. Next slide, please, Simon. It's part of a bigger pathway, and what we found is many people want to ring the helpline just for a listening ear, and that's absolutely fine. What we've done is we've connected the helpline to the Lincolnshire Directory of Services, so that people can be signposted on to things that are going on in their patch, whether that be a coffee morning or a group or some social support. The pathway is an all-age pathway, so if we have anybody that rings the pathway that's under 18, that will automatically go through to the LPFT Crisis and CAMS service. What we've also done is connected it to what we're calling the Crisis Cafe. So if somebody phones the helpline and says, actually, I think I'm okay, but I could do with going to speak with somebody that's safe and warm, then the helpline will divert people into our crisis cafes that we've got building across the patch. Next slide, please, Simon. Thank you. So where are we with activity? So we're averaging about 1,300 to 1,400 calls a month. And you will see from the chart that what we found in August is we had a real spike. We went up to over 1,700 calls a month in August. I'm pleased to let you know now, and I'm sorry I haven't shared this last bit of data, is for the last quarter, we've seen that levels resume back to about 1,300 calls a month. The average call time is about 7 minutes. And what's absolutely fascinating is throughout COVID, we've seen the helpline change in its use. So we've got over 30% of our callers calling more than once a week. And indeed, we've got a cohort that actually phone the helpline daily. And that's fine. People are saying that they're socially isolated, they want to chat to somebody. And if that means we can use our helpline to ensure that we don't add pressures to our frontline services, then that's absolutely appropriate. The other thing we've operated is that if anybody is truly in crisis and the call handlers are worried about them, they will warm transfer those calls without the patient even realising into the crisis nurses based in LPFT. And what we have seen is in August, that average was about 3% of calls going to the crisis team. Today, it's about 6% of calls. So we are seeing an increase in acuity for people ringing the helpline. We've got some poorly people ringing the helpline. Overall, the feedback is very positive. We've managed to keep it staffed and going all the way out throughout COVID. And many people just say it's just lovely to speak to somebody anonymously and just get things off my chest and reframe things, and I feel happy enough to carry on again. Next slide, please, Simon.
So as Rachel said, the helpline is, the callers on the helpline have access to the Directory of Service Connector Support, which was designed by Lincolnshire County Council. And this will be able to signpost people to support within the community that are registered within the connector support system. Next slide, Simon.
Thank you. So this demonstrates one of our really successful partnership operations. So the Active Faith Network has been involved with this transformation programme from the outset through the Mental Health Hub development. And what they intended to do was to provide a nightlight cafe service for out of hours, direct from calling into communities, open at the moment throughout the weekdays and into some evenings. There's been some barriers experienced through COVID-19 because actually that started to limit what we thought we could do with face-to-face that we'd initially planned. But actually what this group of partners have done is continue to provide their service, starting with on-call helplines and now returning to face-to-face in a safe way within the guidance. The role of those cafes is really important in getting our support out through those communities, but in partnership with the Active Faith Network, and actually starts a programme, as it states on the slide, of a partnership of over 70 churches in Lincolnshire, providing that alongside us as a key partner. Thank you, Simon.
So one of the things that we've been working really closely with to deliver this mental health universal offer is our third sector partners. And through the mental health transformation, we now have social prescribers in our pilot sites, and the intention is to have 2 in each of the PCNs. The social prescribers have been supporting people to connect to interlocal services. They've also had a really strong digital offer. So we've got over 31 social prescribers now trained on digital using the VitraCare platform, which will measure patient outcomes, but also allow the third sector colleagues to safely connect with people digitally. So it's all safe, secure, encrypted. It's not FaceTime. It's not WhatsApp. And that's been a real success for Lincolnshire. The other thing that we're keen to do as well is expand our peer support workforce. We've had some great guidance from Health Education England about how we ensure that we have a safe, competent workforce that's trusted and accredited and approved. And the final offer is, again, the digital offer. So the really beautiful example is of students at Lincoln University. We've got over 5,000 students at Lincoln University connected digitally to a platform so that they can look after themselves, self-manage, seek help through a web chat, which then actually, if they want to speak with humans, it will then link through to the mental health helpline. So this is just the model where we're trying to promote self-efficacy, and so that people know how to look after themselves. Thank you, Simon.
Thank you.
I think I've probably just covered most of the digital offer. I think what's worth just expanding on is obviously there's a group of people with long-term conditions who have mental health needs, adjusting to their condition, and a really nice example of that is those people who've had a heart attack. And what we've been doing is we've been running a digital cardiac rehab programme so that people from their own homes can connect to their physiotherapist and their cardiac rehab nurse for a weekly session, undertake an exercise programme when it's linked to System 1 and the GP practice, so we can see their heart rate resting and active. And the feedback we've had from those people throughout COVID has been phenomenal. They've been saying, if this digital offer hadn't been present, because I'm not allowed to see people face to face, I would never have been able to undertake my exercise programme and get back to good health. So there's been some really exciting stuff that's been accelerated due to COVID. Thank you, Simon.
Thank you. Population health is one of my key passions, so excuse me if I get excited about this one. So in terms of our target population, this slide depicts our whole population approach to mental health care. And what I said earlier was about prevention, early response and into professional services. But actually the universal offer that we're presenting today really is a whole population offer. So it has the potential to reach every single member of your communities, but also connects us as organisation in addressing some of our key outcomes together. And our outcomes essentially are going to be the health and the well-being of the people who live in our communities, and this is a way of accessing that. In the middle section of the triangle, obviously we do have a cohort of people who are known to us, who are registered with the NHS for support with their physical and mental health long-term conditions, who make up about 30% of our population. And obviously the universal offer will also support those individuals in terms of staying well, and actually that drop-down level of support when they've completed treatment or whilst they're within treatment to help people to stay well and support recovery, mental health. And then we've got the 5% of our population who have more complex needs. This would include our rough sleeping and homeless communities, who I know we discuss in this meeting also, but a really, again, an integrated approach to supporting. So really demonstrating within this slide that actually this particular service line and this way of working together will reach potentially every single member of your communities in a way that we've not done before. And to give you, figures, and statistics, 752,000 population in Lincolnshire, and LPFT in terms of professional services see around 75,000 of those patients on average per year pre-COVID. That's obviously likely to increase given the pressures of C19 at the moment. But actually our outreach and our work together for this piece of work will see us reaching everybody and preventing mental ill health in a way that we haven't been able to reach previously.
Okay, just to sum up from the presentation, so the first wave of community mental health transformation funding supported the 4 exemplar sites, and also personality and trauma pathway and community rehab services for both Lincoln and Gainsborough areas. We're currently working on the next phase of funding, which is the Wave 2 funding for an additional 1.4 million, which Rachel mentioned earlier will go on to accelerate 5 further PCN sites as listed on here. Also, crisis alternatives along the East Coast, and 600k for mental health liaison to extend mental health liaison at Lincoln County Hospital. So we've worked together to develop a 3-year plan, which we now have in place. So what we're hoping is by 23-24, we'll have whole county coverage for all of the PCN sites to have integrated place-based mental health teams. And that will take us to a value of 12.8 million to be incorporated into mental health services in Lincolnshire. Okay, that's the end of the presentation, so we're happy to take any questions that you may have.
Excellent, thank you all for that. I'll make a start, actually, if you don't mind, because I've got involved in this process by default, that somebody has run into a situation, and actually amazing how it's come back to me, but it has. And I've sort of half started, I've trying to pick it up, and thankfully something like this is essential, because in a sense, the only other outlet I went to was the wellbeing service. And of course, it's actually not really quite at that point. And what the situation is the guy got furloughed. He got made redundant. So he went to the job centre and he was supported to go to the job centre. The job centre then said, and got it wrong, because they said, right now, technically, we can't do anything for you. Goodbye. Well, that was because he was still in the zone of the redundancy period. What they should have done is delayed it. So what they've then done is he's now gone back to his house and has gone into crisis mode. And he's on his own and he's going downhill fast. Now, this guy, and I get this, because the problem is when you've got mental health issues, you don't necessarily, and I'm not speaking for all, think logical, clearly and capable. And so in effect, he's now on his own going downhill with his ex-works getting hold of me. The problem is he's also on the boundary with northeast Lincolnshire. And so I then have stopped, so do I go to the job centre in northeast Lincolnshire? Will that connect back? Or actually, am I better going to the one at Louth? I don't even know if Louth's still going. But in all of this, he's in this, what he actually needs is someone to hold his hand and just go through process. Actually, he just needs to get back into a job and he will do any job. But without a job, he's going into crisis mode and it's going to get worse. And it's actually what comes first. And so I'm trying to sort of now unravel it, and I actually haven't really got the masses of time to put in. And in some sense, if somebody actually just led him a little bit, he will then be all right. If we don't do anything, he's going to end up in a right mess. And we're seeing this, and he's completely isolated. So, and of course, what do? I can't even go and take him to the job centre. So it does become a real vicious circle, actually. So, and I think that this will actually start to do it. And I hope I will get him to call and try the system out. But somewhere in the system, somebody needs to lead him and not just tell him on the phone and go digital, because he's not in that zone. And that's the bit I have to just make clear, because it really is quite a good case for this situation. On the other note, I then bumped into someone else, because as I've gone through the paper, which I like, and I like what you're doing, and I think it's very good. I think when in page 15 on background, universal offer, you did talk about people with severe and moderate needs, where actually what you're really talking about is universal needs to start with, and then as that pyramid goes, so does the person. One area that I think is crucial is therapists, and getting the right therapist that connects with the right person, because sometimes they're not experienced enough and don't really handle it well, and they need to escalate it up. But actually, I'd happened to bump into someone that does therapists this morning. And she says, do you know, I do it with young teenagers. And she said, what I do with them now, because they don't really want to do, it's all Zoom if you're not careful. But she said, I meet and go for a walk with them. Social distance walk, 45 minutes. And actually, you'll be amazed, Hugo, how they open up, because they feel that they're just there with that one person in the open space, and it's amazingly good for them. And you sort of sit there and go, oh, I wonder if that'll be deemed as essential walking or a health walk. But it's actually brilliant initiative in a lockdown. So they're just some of the things that I'm finding. So I will test the system out and with this guy and see what we can do. But I fear the job centre needs to be a little, they're the ones to watch, because if they don't do the help and just say, oh, go on the IT. I've rung them up myself, actually, for this guy, and it is a nightmare. No one answers the phone. They just say, oh, go digital. Well, this guy can't do that. And actually, instantly, we've got a failing with the job centre. And I hate to say it, there's no reason why they can't be on a phone and contactable. They just all sat in an office and now disappear off and with no contact and just a voicemail. I think it's pretty shocking, actually. So I do think they could be the weak link in your system, by the way. That's my bit over with. Justin?
Thanks, Councillor Marfleet. I mean, the peer support workers are a critical part of this, really, in terms of that human interface. I mean, I don't know if either Claire or Rachel just wanted to very briefly cover the role of the peer support worker and also talk about sort of some of those people actually being experts by experience.
Yeah, I can do. So we've got a range of peer support workers across the entire system, but they do come under a number of names. We've got peer link workers, we've got peer support workers, we've got care navigators, we've got community connectors. And to be honest, it's a little bit piecemeal. And so as part of the mental health transformation programme, in the next year, what we've done is in the 1.4 million, we've included funding to create a peer support worker strategy to embed the Health Education England competency framework. And that says that actually for mental health, we do need people with lived experience. We've got some fantastic examples of those with LPFT, particularly in the Children and Young People's Service. So these are people that have gone through crisis services and have now come out the other side and want to give something back. And so they're now in paid employment to act as peer support workers and walk alongside some of those young people. As part of transformation, what we want to do is expand their role. So at the minute, they'll support people up to the age of 18, but we're saying what we want them to do is support people up to the age of the 25 if those individuals want that support, so they don't feel that they, as they transition to adult services, they're losing their peer support worker. We've also got examples of other peer support workers in different areas of the system. So we've had peer support workers in some of the community rehab areas to help people transition out of hospital care where they've perhaps been there for a long time and are frightened about getting on a bus to go to a snooker club, and they just need somebody to walk alongside them to do that. And what we'd like to do going forward is utilise the Shine brand. So Shine is an organisation within Lincolnshire that encompasses many mental health, user-led small and community groups. What we'd like to do with Shine is when people have peer support workers, they have a set training. So they've got safeguarding training, they have mental health first aid training, they have boundary training. And what we want to do is give them an accreditation and almost like a Shine badge, so that we know in statutory services that these is a trusted set of workforce, because we are a little bit concerned that at the moment we have got places where people will set themselves up and call themselves a peer support worker and they're not known to any statutory services, and we wouldn't advocate that or would feel that was a bit risky. So what we'd like to do next year is this part of transformation and really expand the peer support workforce, both for paid and unpaid. We've got loads of volunteers who say, I'd love to give a day a week, I don't want to be paid, but let's bolt them into this framework so that they have refresher training and are up to speed.
Yeah.
And just with regards to DWP, they were members of our partnership group when we did the mental health universal offer, and in response to COVID, I can tell you they have increased the number of employment advisors.
Right. But I mean, if you do feel, I mean, it would be helpful to get that feedback, Councillor Marfleet. You know, it is a system under development, but equally, I'm sure if we speak to Lorraine and Rachel, we can, and Claire, we will be able to connect people into the right support.
Yeah, no, that's good. Thank you. So, okay, well, I've got Liz and then Julie.
Thank you, Chair. On an early slide, I was really pleased to see the funding for perinatal care. This must be a very hard time to be pregnant and give birth. I'm sure you're all aware of the phrase, it takes a village to raise a child. And sadly, at the moment, new parents are having to cope through pregnancy and birth, pretty much alone, without much support from family or friends, which must be really difficult. So I'm pleased we're aware of the issue because the COVID crisis is exacerbating everything. And I think we could find a lot of issues coming from young mothers, any mother. I mean, having a baby is hard at any time, but this must be really difficult. So really pleased to see you've got that, that we've got that. But I think we're going to need more funding for that soon. And the other thing was, I wanted to say how good the stuff is that's going on Facebook. I've seen that bottle image several times. Don't bottle it up. It's brilliant. It's simple. It's fun as much as it can be. And I think it's really the way to get information out to people is in a visual way like that. And we're all using Facebook so much more because, we can't get out and do other things. So, pat on the back for that. I think it's wonderful. Thanks very much.
Excellent. Thank you. Liz, Julie, sorry, and then Rob.
Can I just say, I think the work that you're doing is really excellent. For quite a long time, I've been sort of emphasising that I think mental health should be on a parity with physical health. And unfortunately, COVID has really brought this to the fore in terms of, the isolation and the mental consequences that will bring. And obviously, this is going to be with us for a long time. It's not going to finish as soon as, a vaccine's found and everybody's immunised. A lot of people are going to suffer long-term effects. So I think the work that you're doing is really, really excellent. The only other question I wanted to ask Hugo was, obviously you've set up a peer support system in various ways. Had this person not got a friend that could just, I know you have to maintain social distance, that could just help him to go to where he needed to go? Because then obviously he would have felt more secure and confident. Or was that not possible?
Well, actually, the guy that's helping was his ex-boss at work, who's also been laid off. And he lives outside the county, and he lives too far, because actually he is the guy I need, because actually he's the one that's done trying to sort out his finances for him.
Yeah, because obviously, sorry to interrupt, because then obviously this person would have trust already with that person, but if he lives out of county, it's difficult then, isn't it?
Yeah, we're trying, but actually this sort of lends itself well, because it is it's one of those, you are at the very beginning of mental health, but actually if you don't nip it in the bud, you're going to escalate it. And that's the great thing about this, which is why it is such a valuable piece of work. And, and the fact that we're going to roll it out is even better. And I think, and it is just something, because actually I have another person that I know well, and he actually lives in, I would say, his parents live in Lincolnshire. He perhaps lives in technically northeast, and actually he's ended up in the Scunthorpe, I think it's a mental health hospital at the time being. And I'm like, whoa, that's jumping across all the boundaries. So it is something that we need to be aware. And I suppose it's perhaps suits him best to be up there. But also, I suspect it's quite good facilities. I don't know, but it does really highlight how there are no boundaries except for what we create, and we need to make sure that in our system, which we are very aware of in the health and social care, is that there are boundaries and they just need to be broken down. Well, not boundaries. So, okay, I've got Rob. Well, I've got Claire. Did you want to just come back on anything, Claire?
It was just about your comment, Councillor Marfleet. Thank you, because I think that's really important about taking down boundaries, not just within organisations within Lincolnshire, but actually we do have really good working relationships with our sister organisations across boundaries. So where we can connect people in Lincolnshire, like the connection that you talk about, we can actually connect with North East Lincolnshire, North Lincolnshire, Cambridge, Peterborough, and do that read across, and just to find the best outcome for the individual. So please don't think that crossing borders is a boundary, because we will work as organisations across them also.
Yeah. So brilliant. Well, I've got Rob.
Thank you very much, Chairman. I mean, I think this is fantastic news. As we all know, mental health issues don't stop at 5 o'clock on a Friday night. And I think one of the biggest problems that I recall is people having problems or sort of in the early hours of a Saturday morning or something like that. And I think having a 24-hour helpline is fantastic. And I will certainly do my best to plug this, because I think it's fantastic news. I just wanted a couple of questions, actually. First, about the helpline. What sort of, do you have any ideas what sort of percentage of people who call it are existing service users? I mean, is it a regular support for them? And also, obviously, unsurprisingly, I'm interested in the volunteer side of things. And it was good to hear that there's a sort of training standard for volunteers working in this field, particularly on things like safeguarding and that. I think that was important. I was just wondering, finally, how the LPFT volunteer service plugs into all this. I'm thinking in terms of, from my experience, people who are service users who go into volunteering. I remember when I ran the service, we had 40% of our volunteers were service users or former service users. And it was such an excellent way of people getting back into the community and getting involved in perhaps even going back into work in some cases. So sorry, I've fired all these questions at you, Chairman, or rather at your colleagues. And I'd be very interested. And I think this is actually a fantastic idea, because boundaries being broken down are so important. We all know how things go wrong when the boundaries are there. Thank you, Chairman.
Thank you.
Councillor Kendrick, I can answer the first part of your question, which was around the percentage of people that are known to services calling the helpline. So the last quarter, so I can give you data from October to December, 40% of the calls were for brand new people not known to anybody. And that would suggest the other 60% were either callers known to the helpline, i.e. they'd called it before, or callers that are known to LPFT services. What we had in LPFT is there were a group of a cohort of people who ran the crisis nurses on a very regular basis, what we've done is we've worked the crisis nurses, and they've worked with those individuals and said, actually, there's a group of counsellors here that you can phone. So what we try to do is reduce the pressure on the crisis nurses, obviously, because they can be off doing home treatment and other stuff. So that's the data. Perhaps Claire could answer about volunteers.
Yeah, absolutely. Really, our volunteers are connected with our recovery college, our employment services, and in fact, this particular service is connected with all of our LPFT services. But yes, absolutely. And in fact, the majority of our peer support workers, as Rachel described, I know it's a different language now, they've come from that voluntary background as well, patient by experience. And absolutely, we've created a programme that harnesses all of that and helps to support us in an evolutionary way with this.
Thank you very much. I think this is something that needs to be broadcast from the rooftops, having this helpline particularly. That it's 24 hours is brilliant. Thank you very much, Chairman.
Yeah, excellent. No, it's great news. Chris?
Sorry. Thank you, Chairman. Yeah, it was just a quick question on. I think Rachel just started to answer part of it actually, but when it was mentioned earlier about people calling the helpline quite frequently, more than once a week or on a daily basis, sort of thing. I was just kind of curious. Are those people that tend to have sort of more complicated needs, or is that people that it's more, as you said, about isolation and things like that, and sort of. Do you do any kind of work to try and get them those kind of people involved in some of the other services and things as well to make sure that they're not don't get overly dependent on on keep ringing the line sort of thing?
Thank you for your question, Councillor Reid. You're absolutely right. It's a mixture of the frequent callers are a mixture of people of some social isolation, and it's very much COVID related. And there's another cohort, and they're incredibly complex. Obviously, the helpline only got switched on in March, and so what we've now done is we've only started to sort of see patterns over the last 6 months of people that we might think are regular callers. And what we've started to do is we've started to develop a call plan alongside the crisis nurses and LPFT to say, these callers are phoning very, very regularly. We're having to put in sort of say, you can ring us every day, but we're going to restrict the amount of time because we're worried about the dependency that we're building up. And actually, what can we do differently? What is it that you need? And this is where the next steps really are to link those people into social prescribing. What activities are they interested in? What hobbies might they be interested in? What could we help to do to connect them back into things that are going on in their community? So I think it's fair to say that only really in the last quarter have we started to see patterns emerging and people that we can start putting a call plan in. But I would envisage that going forward we will see an increasing number of people who call the helpline frequently have a caller plan.
That's very good. Very good. Yeah, and I think social prescribing, is you actually summed it up really well. Most people turn it into a complicated beast, but actually you're right. It is just about finding their hobbies and aspirations. And I always say half of this is nipped in the bud if they just find something rather than left sat dwelling on what's what. But excellent. I've got Councillor Marianne Overton. Welcome, Marianne. Here.
I hope I'm not mad. Thank you. Very good to be here, and I apologise I was a few minutes late. And thank you also, Rachel, for helping me. I think it was last week or wherever when we, working towards getting support through Kekoli Chowdhury for our COVID groups. So thank you very much for that. What I'm getting from my residents, and in fact it is particularly the younger residents that are, less than retired, and they are. Mental health is the biggest concern that's coming forward, and so I'm really, really pleased to see this. And thank you also, because I think it must be that we had been pushing for this for a long time, that we managed to be one of the 12 areas. So I think that's a really huge commendation. So thank you also for that. I am pleased to see the line and the workers that have been mentioned, the peer support workers, and that point about going for a walk sounds perfect. I think, and hopefully we could encourage them to do that every day, would be brilliant. I think on the other thing I was thinking is getting more volunteers involved. Is peer support worker the right way to go, or are there other routes as well? We've had some talks about mental health first aid training or anything else that we might be able to offer committed volunteers in the community who aren't expecting to be trained professionals and wouldn't dream of redirecting anyone. Obviously, we want to make sure that those that need professional help get it. We're not talking about interfering with that in any way, but just making sure we can help listen and signpost. So are there different levels of ways in which volunteers can offer support? Thank you.
I'm just wondering whether I can speak to that one actually, because when we started the mental health community hub and the mental health hub work stream, it was exactly that drove us. And it was really about connecting the wealth of assets, or we say community assets, and people who are keen to support their own communities in helping people to get back on their feet. What we found with the hubs, as we call them, or the community hubs or crisis cafes or however we name them, is that people will flock to them to offer their voluntary services. And that's whether it's a professional voluntary service such as the Red Cross or Beehive or Askerfield Farm Project out in Stickney, or some of the Gainsborough models, to individuals who just want to turn up and make people a cup of tea and make some cake for a local cafe. And I think that's fine at all levels. The key element is, how do we safely, as Rachel described earlier, connect all of that together? The hubs provide a brilliant opportunity as a base to do that. Shine and the Shine Network provide provide a brilliant infrastructure to be able to make sure that the right people are in the right place at the right time with a skill set or a coping mechanism for some of the things that they'll see. But actually, yes, it's about all aboard. And how do we do that together in partnership between us within your communities to really get that off the ground and get the hearts and minds and passions about it, because that's where this lives. I want to give you a really brief example of one of the really successful models in Gloucester, which is called the Barnwood Trust. They've been running for about 25 years. When you walk into one of their cafes, they call them urban roots cafes. They're run entirely by volunteers. They're supported by voluntary sector in terms of rotas and staffing, etc. But when you walk into that environment, what you get is a warm community hub, community cafe type feel with mental health professionals, health professionals and trained volunteers milling around as though they were friends and community members that can, in a similar way to the way that Dementia Friendly works, identify themselves as key connectors to professional services should that be required. And I guess that at the community level is the ideal, the unique vision.
Excellent. Okay, that's I think been very useful. Can we have the poster and the helpline number sent round with the link with the video as well, please? Well, I think, at the end of the day, everyone's very supportive of this. It's a great piece of work, and I think it's one of those that there's so much to do and so much to achieve, and we're sort of certainly going in the right direction, and it's great that we've got to where we have, and we've been selected to be a sort of a pilot, and we're rolling it out, and it is universal. So great job, and we'll look forward to sort of it coming back. Whatever happens after the elections or whenever they happen, but I think it'll certainly be back to the next committee in the next session, and but up till then, keep up the brilliant work. Thank you all very much. Justin, did you want to just come back?
Just a final word, thank you. Yes, I mean, it is a journey, so we've made a really good start, but we are really ambitious in terms of what else we can achieve in terms of our joined up working. And I'd just like to say a big thank you to Lorraine, Rachel and Claire, because I think, it's much stronger when we all present this agenda together. This really is a great example of partnership working in Lincolnshire. And, and that's the way that we need to continue making progress with this agenda. So thank you.
Yeah, brilliant. Thank you. Thank you all very much. So, okay, we'll move on to item 6 then. Adult Care and Community Wellbeing Budget Proposals 2021-22. We've got Pam Clipson here, Head of Finance. Welcome, Pam. Good to see you back.
Morning, thank you, Chair. Happy New Year to everybody. No, not much new about it. It's a bit like Groundhog Day, isn't it? Hopefully you've all got the finance paper in front of you. It is a bit different this time, purely because we're still waiting for things like the final government settlement. So things like that still haven't come out. Obviously, for reasons we're all aware of, there are some delays in central government. So I'll take you through the paper as it's written and then take any questions at the end. First and foremost, the spending review. There are, from page 33, some of the key messages on there for adult social care. We have got access to nationally 300 million social care grant coming through, and they have confirmed a continuation of the adult social care precept of up to 3%. And there are proposals going to full council with what that could look like for us. Over the page on page 34, I have noted there was still an increase to the national living wage, but not as large an increase as was originally planned. And the reason I've highlighted that is because that impacts our rates that we offer to our social care market. There isn't, for 21-22, an increase in the public health grant that we'll receive. However, they have confirmed that there will be ongoing support for public health as a result of all things COVID-19, which for our local authority is in the region of £15 million at the moment for 21-22. The improved Better Care Fund that comes directly into LCC, which is about £33 million each year, is maintained but at its current level. So there is no reduction, but there is no increase either. The Disabled Facilities Grant, that has seen an increase. Again, that's part of our Better Care Fund with our partners across Lincolnshire. And the final element of our Better Care Fund, which the Clinical Commissioning Group received directly, is the minimum income guarantee, which will see an increase of 5.3%. And we'll come on to later what that means for adult care in particular. At the bottom of page 34, we have done some work around the budget with our budget holders, and we have continued to maintain our medium-term financial plan, which currently goes through to 2023-24. Obviously, we don't have a crystal ball, so it's the cost that we know about at the moment and what we think will come our way. With all the elements that we're aware of and the monies that we've received from central government across a raft of areas, some of which we touched on at the last scrutiny, there is the potential that we will continue to remain within our financial allocation as adult care in 21-22. So our focus will, from a strategic point of view, move to 1st of April 22-23, where we are forecasting potential pressures to hit. Bottom of page 34 onto page 35, we're not proposing any changes to the financial structure of adult care, so you've still got our three main bodies that are listed there. You'll see the table on page 35 shows an increase, and it just shows where we've placed that increase. Again, two significant costs that adult care face each year is the forecast financial rates increase, and we were working with our providers this week, particularly in residential care, to negotiate those rates. And then the second largest cost increase we see is the forecast growth for social care services. And you'll see there we're forecasting additional costs of just short of £2.7 million, which is between 1.2 and 2.9 growth, depending in which service we're looking at. To enable us to continue to live within our financial allocation, we have developed, as adult care in its widest sense, a programme of service improvement, some of which you've heard this morning, so mental health, and Councillor Bradwell and Glenn referred to some of them earlier on. The ones that will help our financial position are detailed at page 36. And what we do is wrap around our financial support teams to work as an enabler for those service changes. Some of those, again, have been here. So the Financial Assessment Improvement Programme, we had the charging policy in April, and the move towards a gross payment mechanism came in October. So again, they're listed on page 36. It's critical that we deliver those to enable us to deliver the financial balance. Included in there as well, the continuation of the Better Care Fund, and also what you'll see later on the agenda is the extra care housing. So all of the things that you hear about through this meeting are built into both our budget but also our medium-term financial plan. And then finally on page 37, I have touched on the Better Care Fund. It will continue into 21-22. We have seen a reduced reporting need in this year nationally as a result of the pandemic. But we are expecting roughly another £900,000 coming in to support social care through the Better Care Fund, which is part of maintaining our adult social care services. And that goes towards the pressures I mentioned earlier, like the rates increase. So in conclusion, the budget as it stands at the moment, like I say, awaiting the final settlement for the local government, it is reporting that we will balance, as all things being equal at the moment, in 21-22. Anything COVID will continue to be supported from the government up to 15 million. That's what we've got at the minute. And I'll take any questions. Thank you.
Excellent. Thank you very much. I think, we've done a fantastic job over the last few years of balancing our budgets and running it within budget in adult social care. I think this year, next year is the right way to go, continuation and roll it on for a year. And I'm pleased to hear that you're planning post 2022, because I think it's going to be very stressful and painful somewhere in the system for all the money that's needed to keep things and the repercussions of what's going on. And so you're right to be looking at that with some quite intense detail, I suspect. But have I got any questions from anybody? Anybody like to ask? Or I think all seems very good. So, right, I've got Marianne actually just wants to come in.
Thank you very much. You said that the budget's balancing and so on. Have you calculated on the 3% precept in the first year rather than spreading it over 2 years?
There are some options which are going to full council, so they're coming through. But on the options that we've worked through, we balance them. I can share that document outside with you if you'd like, Councillor Overton.
You can't. It's not public, is it? Or
not
is it?
It comes later.
Oh, I see. So okay, thanks. I just couldn't see it on the paper. That's obviously why then. Okay, thanks a lot.
The timing of the papers.
For anybody listening on the audio, in effect, there's various options, and it's about capping and spreading and deciding which option is the best. Is it, if I remember right, it's they've re-brought the sort of adult social care precept back again. It was capped over a 3-year period previously, within which you could only go to a maximum, or you could go even over the period of time. And I suspect it's similar this time round, isn't it?
It is, and there's a deferral option in there as well that we need to consider.
Yeah. So,
thank you. I have been working with the government nationally on that as well, so I was just pleased to see it come through, but I was interested what your thinking was on the Lincolnshire, but very helpful. Thank you very much for your useful comments and for your good work.
Yeah. No, I think, no, it's a very good budget. Stand on, let's keep everything going and let the dust settle. And the fact that we're paying attention to the year after is vital. So very well done to Pam and the team.
Thank you.
So I suppose, hold on, I perhaps need to just, what do we need to do? Well, comments we support. And I think we've sort of addressed most of the comments. So forward on to the County Council. Thank you very much.
Thank you.
Okay, we'll go on to item 7 then, extra care housing, Hoplands. So now we've got Kevin Kendall, and I think Emma Rowett is also on or about. Suppose you're going to take the lead to start with, Kevin and Emma.
Yeah, I'll kick it off, Chair, if that's okay. And then there's a couple of us, then others joining as we go through the slides. There's about 8 slides we'll go through for you, which summarises the report we're presenting today. So it's a pre-decision report. Are you okay if I commence?
Yes.
Yeah. So it's a pre-decision report for the executive, and if I can move on to the next slide. So this is for Hoplands extra care housing development in Sleaford. It's called Hoplands because it's on the site of a former Hoplands depot, County Council depot in Sleaford, but it also includes extra care proposal and community supported living for working age adults. So the recommendations that are there, the 4 bullets, so we're the recommendations for the executive to approve the payment of 2.56 million from the capital programme to North Kesteven District Council to support the development of the facilities in Sleaford. And as part of that, the land the County Council currently owns, we're recommending approval that the land is sold for undervalue. I've put this 0.96 acres, and the undervalue is worth 650,000. In addition, the remainder of the site, which isn't required for extra care or space for working age adults, it will be sold to Lafford Homes. Lafford Homes is North Kesteven's wholly owned company, and they'll be building market housing for rental on the remainder of the site. And the final one, the recommendation is that the executive delegate the final contract and funding agreement to the executive director for adult care in consultation with the executive councillor for adult care, health and children's services. So those are the recommendations. If I can now pass on to Gareth Everton.
Just while you're on that page, Kevin, the approval for the disposal of, it's got 0.81262 hectares of the site to Lapford Homes. Is that the right hectareage? Because on the map, it talks about 0.467.
I couldn't answer that now, but I can certainly check that.
Yeah, I just wonder if it's sort of, I'm not quite sure how those two, but it's perhaps just might be just me, but it was just when I was looking at the map, I was thinking, hold on, we seem to have a couple of, so I wasn't quite sure which one was which, but I'll leave that one with you anyway.
Yeah, thank you.
Are we okay?
Yeah.
Hi. So the next couple of slides, we're just thinking about why extra care, why community supported living, what are the benefits of that approach, and then a bit more about how much of that type of accommodation we would require as part of the scheme. And I think it's reflecting that traditionally in adult care we have a reliance on home care or care home accommodation, and a lot of work that's gone on to try and grow additional services in the middle. So particularly in working age adults around community supported living has been around for a while, and how we can grow a similar approach for older people around extra care. So for me, it's the best of both worlds. You know, somebody still has their own front door, they have their own tenancy and a home. That's not part of a commercial relationship with the county council. We don't pay for the accommodation. But obviously we have some economies of scale around a building which we can mobilise commission care and support. So that helps us to meet people's needs in a more flexible way that's person-centred, and ultimately allows people to age in place rather than having to need to move to something like residential care accommodation. So what we've tried to do there is articulate some of the benefits and objectives of this type of approach. If we can move on to the next slide, Emma. Sorry, Emma. So this slide is kind of looking at what the potential demand looks like. I suppose it's there to show some of the complexity around how we model demand, and I would say it's more of an art than a science. So this slide is something that came through the Housing Lin, which was an organisation that we commissioned across the county to look at potential demand for housing for older people. Snapshot in time around some of the projections. What we don't have is the underpinning assumptions that this was based on, but there are some assumptions in there around demand and how it changes. So from an older person's, from an extra care accommodation perspective, that external piece of work suggested that we currently in 2020 would need 168 units of extra care accommodation in the North Stephen district area. Now we can overlay that with different assumptions around care home placements a year and numbers of older people in population. So I think there's a degree of confidence in 2020 that we need between 136 and 360 units of extra care accommodation. Now what we know is today we only have 56 in North Stephen. So there's quite a degree of an order of magnitude there for what we need, and certainly 40 additional units from this proposal will still be within that lower estimate of what the demand would be. And what we can project that by 2040 that we'd need something like 547 units of extra care accommodation in North Stephen District Council area. So we're talking, large numbers of need, and how we can support markets to fill that gap in a more organic way going forward. In terms of working age accommodation, what we've got is some national estimates of what demand for working age accommodation, community supported living would look like, and trying to prorate that down to the county council boundary would tell us that we need about 994 additional units of working age adults accommodation in Lincolnshire, and that could grow to being 1,239 by 2030. So we know that there's a demand there, and this helps, like Pam was saying earlier, to help us with the financial sustainability of adult care in different ways. And there's a couple of sections of finance later on. So thank you. So I think Emma's going to pick up the next slide.
Thanks, Gareth. Yeah, so the proposed Hoplands project in partnership with North East District Council will enable LCC to purchase nomination rights for all 40 extra care units, as well as the 12 community supported living units for working age adults. LCC's contribution of 2.5 million, 5.6 million, apologies, will provide nominations for a period of 30 years with no void risk to LCC. As Kevin mentioned earlier, the intention is to dispose of a section of the site to NKDC, and that will be at nil value to release the benefits of this project. And the remainder of the site will be sold to Lafford Homes, which is NKDC's wholly owned property company, for market rental accommodation. The project legally complies with LCC state aid and section 123 of the 1972 Local Government Act, which enables the lawful disposal of an asset and undervalue. Construction is planned to commence in summer 2022 for completion in spring 2024. And I'll hand back to Kevin.
Thank you, Emma. Just to conclude on a couple of slides on the finance. So the source of finance for the project is the unused capital reserves, and that is 7.9 million currently. And a breakdown of this particular scheme. So the average residential care cost in comparison to extra care is £27,566 per annum. Extra care is estimated typically at £16,000 per annum, so that represents a gross saving of £11,445 pounds per annum per unit. And in terms of the investment, the £2.56 million investment for the project, that could generate an annual saving of £127,000, and based on that, the payback for the project will be 18 years. And the funding agreement is for a 30-year period, so it does pay back well within the agreement timeline. And if I can move on to the final slide. So in conclusion, the project, if approved, will increase the provision of extra care and also for working age adults with learning disabilities and mental health in the county, and will assist the council also offsetting future revenue costs as well. It importantly provides Lincolnshire residents to be able to live independently as long as possible in their localities, and therefore improving wellbeing and quality of life. So to aid LCT to use existing use of assets as well, and in the new developments. So it has a number of benefits to the County Council and the residents of Lincolnshire. And that concludes our report. Thank you.
Excellent. Well, I'll open it up to the floor for any questions. Personally, I think it's a very good design and planning of a site. I especially like the fact that we have the catered for the working age adults in the site as well. In fact, it would nearly be one, I think, is it one of our flagship potentials, this? I think it's, it really is very good. So I've got Christine first and then Julie. Your microphone, Christine.
Thought I'd tweak there. Right, it's done now. I really welcome this. Extra care is something I have been passionate about for a good many years. We are still struggling at South Holland, but we will get there in the end. But this is a much needed provision, and I envy North Castevens Hoplands development. The size of the development allows for social housing as well on the site, and I can only congratulate them on their fortunate escape that they do not have any involvement from Network Rail on the site, as we have struggled for years at South Holland with that. I cannot tell you the feelings I have towards Network Rail. They are not kindly. But I really welcome it. The concept of extra care provision is really absolutely fundamental to improving the life of people who do not need residential care, who welcome their own front door. They can live independently, but the help they need is on site. I couldn't be happier for this proposal, and I welcome it wholeheartedly.
Excellent. Thank you. Julie?
Well, I'm just reinforcing really what's already been said. I think it's really fantastic that people can maintain their independence, live in the community that they actually know, which I think is really, really important. And the fact that it's going through the age range. Obviously, as you get older, you need support, but that's also available. And I agree with what you've said, Councillor Marfleet, that I think this is a really excellent idea and possibly is a flagship issue, because it is something that, you know, I've got parents who are 87, they're still in their own home. They didn't want to move to, you know, a care home. They've got lots of support from neighbours, and that is the general mentality, isn't it, of people who are getting older. They don't want to move out of their own home. And I think if we can be seen as a local authority to be doing this or trying to move towards that model, it's excellent.
Excellent. Thank you very much. So I've got Marianne.
Thank you very much. It is in North Kesteven, and I declare an interest in North Kesteven District Councillor. I don't know if I need to really. It's scrutiny rather than decision making. I am very pleased to see this, because I have in my area sheltered housing, which isn't anymore. We used to have warden living on site, and it was very effective and very well liked. We do still have the housing, but the sheltered part is now provided by electronic means through Lifeline. And this, to me, seems to be a really good solution. I just wonder if I might ask, is there any connection, you know, how it is different to what we used to have, perhaps, and how it is different to what I've got in my area at the moment. I'm not quite sure how much extra care there is going to be. Is it on site or is it provided by the day? Certainly, I find that having what used to be sheltered housing is groups of houses within the community that are occupied by people with extra needs does mean that it's much easier for the services to be provided, because they can go from one house to the other, and it certainly makes it a lot more straightforward in that they haven't got to drive miles down long tracks or anything, that everybody's easily accessible for care. So it does work in my experience, and it's a very nice environment. So I wonder if I could just ask, are we recreating something but a bit better? Certainly the housing quality, I'm sure, will be really good. Perhaps you could just help me with that, but it does seem a very good financial model that you've worked out as well. So thank you.
Chair,
I'm happy to
refer to Gareth on the care provision. Thank you.
Thanks, Kevin. In terms of the model of extra care, I think it is a step on in terms of this support from kind of supported housing, sheltered living schemes. There are elements that we can be really clear in terms of the specification. So the commission services that go in there, it forms part of our home care procurement, and there are specific sections on extra care accommodation, and the expectation that the care provider will have a 24/7 presence and some flexibility in how that care is delivered. Now, the nature of the part, because we don't have a partnership agreement with the housing provider, it's a nominations agreement. We can't be overly specific on things like the monitoring, the falls response. Some of that will come through discussion with NKEC and how that's going to be delivered, and the registered provider that will manage the scheme. But certainly about how we maintain people's support on that 24/7 basis, while still recognising that this isn't duplicating care home accommodation. So it will be different. It's not kind of on demand support, but that there will be additional support.
Thank you very much. I'm glad to highlight that, and I'm glad you're aware of it, because that is a risk that doesn't actually happen. It could be a risk. So I'm really pleased that you're onto it, and I'm sure you'll make sure it happens. Thank you.
Thank you.
Okay, thank you. Rob?
Thank you, Chairman. I think it's interesting that this comes after the previous item on mental health, and I can see this as something which will be a contributor to improving mental health for the residents of the extra care home. I think it seems to be an excellent concept, and particularly as there's an all-age range idea behind this. It strikes me as it's actually a win-win situation for the people who are going to live there, but also from a financial aspect. So I'm sure, as you say, this is going to be a model that hopefully will be replicated elsewhere. I think it's a great idea. Thanks, Chairman.
Thank you. So, anybody else like to speak? I think, no, we're all very impressed. So, yeah, very good job, Kevin. And I think, like all of us, we'd like to see more rolled out as soon as possible in other areas. So, but just coming back to that hectare, I think where it all comes is, if you look in the bank's long report, they flip between hectares and acres in the same document, which is not very helpful when people do conversions back from one to the other. So I think it's just something, but the principles are still exactly the same. And, and I think it's a very well designed community provision, actually. Brilliant. So excellent. Well, thank you very much. And I think really additional comments to be passed to the executive. Well, we just fully support and look forward to more being rolled out. I think the key thing is finding the right areas, and this one really is a great area. So, Glenn, would you like to come in?
It's on your last observation, Chair, related to comments to the executive.
Yep.
Clearly, we're moving towards a period of elections for local government, albeit the potential to be delayed exists. My hope is that the administration will continue to support the development of appropriate housing for people that we're concerned with in this committee in the new electoral cycle, and whether that might be an interesting point for any future manifestos.
Yeah.
Nudge, nudge.
Good idea. Good idea. It'll be my personal one anyway. But just while you're there, Glenn, I mean, this sort of the way that they've sort of gone through, calculated the sort of potential savings, etc. I can't help but think when I'm sort of reading this, it's sort of one of those, when you look at our hospitals and how we sort of like to get people back into the community, but sometimes the house isn't quite there or suitable, and we then get sort of caught between the likes of, do they go in a residential home for like a respite period or something? I mean, it's a sort of, in a sense, a model, isn't it, that could just be where you've got some what I call lower tier care flats, well, a sort of accommodation. So it's sort of, you come out of a hospital ward, which is very expensive, to sort of like a halfway to get back to the community. And it's sort of one of those where you feel that it's sort of a bit of this model could be utilised by health to sort of stage that return in a more controlled, better way. But it's the same sort of model, really. But that's only my views. But
thank you, Chair. And I can see that Justin is still on the call. What you've just described is precisely the plan for working age adult groups who are in very expensive and possibly inappropriate long stay inpatient facilities, not always even in Lincolnshire.
Yeah.
So working with our NHS colleagues and our district colleagues, there are real opportunities not only to find better housing options for people of a working age, but also ones that are in Lincolnshire and not somewhere else in the country. I'll let Justin come in there, Chair.
Yeah.
Thanks, Glenn. So, yeah, we've established a joint accommodation strategy group, which I chair, and we've got senior responsible officers on that group from both the CCG and LPFT. And recently, Councillor Wendy Bowker has also kindly agreed to join that group as well. So we are exploring a number of different avenues in terms of maximising people's independence through an accommodation and care route, really. And as Glenn says, we've got various strands to that strategy work, including some bids to NHS capital funding as well, so that we can draw some of that down to help people with complex needs. And then we also source some accommodation through our existing framework contract contacts as well. So, but this is a very, very welcome addition in terms of it. And like yourselves, I would like to see, and other initiatives in different parts of the county here, because it really, really will help to maximise people's independence.
Yeah. So, excellent. All very encouraging, very good news. So, brilliant. Well, thank you all very much, and thank you very much, Kevin. Great piece of work. So, okay, we'll go on to the next item then. Item 8, the Director of Public Health Annual Report 2020. Welcome, Derek.
Thanks, Councillor Marfleet. What I'll do with this, if everybody's comfortable, I'll just give a couple of the headlines and talk about the structure of the report, because there's lots of questions I'm sure people might want to ask. I can also give an update on the current situation in terms of COVID, if scrutiny would find that useful. So we were planning to build upon the report that we did last year, Scrutiny Remember, which was using the global burden of disease methodology. So that was the years of life lost and years lived with disability. And Heather and I were hoping to have a dedicated report looking at children and young people's health and well-being using that methodology. Clearly, global pandemic put paid to those plans. So what we've done, and considering we are still in response mode, and as we were writing the report, we were absolutely in the thick of response mode. We've tried to pull together existing work that we were doing as part of the COVID response anyway. So we had a coherent summary for the people of Lincolnshire about what we have done in terms of response to COVID, all in one place. And that's the nature of the report, really. A little bit about the introduction in there. We've talked about the impact of COVID on the Lincolnshire population in terms of the number of cases we've had, how we are testing, how that's fed through into hospital admissions, and sadly, in terms of deaths. What we have done in terms of supporting our care homes, our schools, our education sector, and highlighting the fact that I think pretty well uniquely in the East Midlands and very unusually across the country, Lincolnshire, as a county council, have maintained funding in public health, for which I am massively grateful. And we have a dedicated health protection team that most places don't have. So we've been able to give our care homes, our schools, our education sector and our workplaces a level of support that most of the places have not been able to do. We've talked a little bit about personal protective equipment, because obviously that was a major issue at the beginning of the pandemic, and we've compared Lincolnshire overall to the country. All of these data, unfortunately, given the nature of COVID, we had to update the data until the last moment, and then fix the data so that we could get the document typeset and published. So clearly the data is out of date. And that was always going to be the case. I'm happy to, at the end of this conversation, if Scrutiny would like, give you a hot off the presses data update. So that was the impact of COVID, but specifically in Lincolnshire, trying to pull together lots of different sources of information into one place. We've then talked about how Lincolnshire as a system has responded, because I think that's really important. And we've talked about the Lincolnshire Resilience Forum and some of the changes and the response that we've taken on board as a system, because I do think that's another I don't want to say good news story because I don't think there's a good news when it comes to COVID, but certainly a positive front foot sort of approach that we've had in the county. And then we've described a little bit about what the next steps are going to be in terms of contact tracing, testing sites, and obviously something that's very high on the agenda at the moment, which is COVID-19 vaccines. So that's the sort of the immediate response and where we've been. And finally, we've started to talk about some of the longer term health and wellbeing implications of COVID-19. This is something that will be a core part of what we will do as part of our business as usual, as a public health division and as a council and as a system going forwards. Whether it's long COVID symptoms, or whether it's helping people with the mental health and well-being aspects of having to deal with COVID and unfortunately losing loved ones, or whether it's the isolation that sometimes comes with COVID, there will be a whole raft of different issues, not least the impact on education and employment that we're likely to see post-COVID as well. So we need to be mindful of all of that, and we've outlined that in the document as well. So that's a quick overview of what we've included in the document. I won't go through the detail because I'm sure everybody's had a chance to look at it. But if it's okay there, Councillor Marfleet, I'll pause. Happy to answer questions on the specifics of the document and or give an update on where we are at the moment.
Excellent, thank you. Well, we'll have an update at the after the questions. I think I've got Mark Whittington first, then Julie. Mark.
Sorry, Mr. Chairman. Momentarily, I thought I was going to be cut off. He all seemed to freeze upon me. I hope you can hear me.
Yes.
Just wanted to ask Derek regarding how we get the message across to people, because you still see people. I mean, just not complying with the regulations in terms of wearing masks and distancing and stuff like that. And we've lost an awful lot of people. And sadly my mother passed away on Monday in a residential home in Lincolnshire, and she'd had a positive COVID test in November. She never really seemed to recover from it. And I just get really angry before and since when I see people just not following the regulations. What can we do to get the message across? It seems to be a minority that just will not follow the regulations. Derek, what can we do? I mean, do we have to show them pictures of crowded hospitals and I just words sometimes fail me, Derek. Hopefully the vaccination process will get us back to some sort of normality. But what do we do about the people not following the regulations, and also the anti-vaxxers who just seem to be plaguing social media with a lot of misinformation? Thanks.
Thanks, Councillor Whittington. Well, firstly, just to say I'm really sorry for your loss, and I'm sorry for everybody's loss through this pandemic. It has been dreadful, and we're not out of it yet. I think the first thing I would say is that at the moment we are in a lockdown. It is a stay-at-home lockdown. We should be in our own homes unless we meet one of the specified legal exemptions that allows us to go out, and that's the first thing to say. And we're trying to really push that message very firmly through the media and to the people of Lincolnshire. I think secondly, it's to point our people towards reputable sources of information. There is, with social media, lots of benefits, but unfortunately one of the disbenefits is there can be a lot of misinformation. And so the NHS website is obviously a trusted source, and I would always point people there. and also the government website, www.gov.uk/coronavirus, is updated very frequently with the most trusted source of information. So it's about going to the right sources. There will always be people who disagree. There will always be conspiracy theories. I think what we've got to do is take the weight of the science, and the Chief Medical Officer said early on that science would get us out of COVID-19, and that's coming to pass. I think with vaccine rollout, we've got a lot more to do, but the vaccine will help us to get out of this situation. So it's reputable sources as well. I think the final thing I'll say on this is lots of information about the new variant, the old variant, the South African variant. The messages stay the same. If you stay in your house with the door closed, you will not catch coronavirus unless somebody brings it into your house. If you go outside in the open air and you keep more than 2 meters away from anybody not in your household, you will not catch coronavirus as long as you wash your hands and don't touch your face until you've washed your hands when you get back indoors. These messages are the same regardless of the variant of coronavirus. So if we stick by the rules, and I'll come on later to the data that suggests Lincolnshire is doing a really good job of sticking by the rules, then we will minimise the risk. But there will always be a few people who decide that they are in some way magically immune, or that the rules don't apply to them. And I know the police service have a very robust response to that.
Okay, I've got Julie.
Thank you, Councillor Marfley. As you all probably know, I live in Lincoln, just near the county hospital, and I'd like to reiterate what other people have said. I'm appalled at the number of people, when I walk to the Bellgate, how many people are completely ignoring, i.e. not wearing masks in shops, which I now know is mandatory, but also not observing social distance rules. And that is the same on Lincoln High Street. And I think, obviously, the police have got a massive job. I think my personal view is that the army should have been brought in much quicker. I think if in March we'd have had an initial enforcement policy, this would not be as bad as it is now. So, as we all have to really obey the rules. And I was just looking, but I can't find this information because I've been given so much information about COVID, because in my division, in Sinsel and on Monks Road, it is one of the highest incidences of COVID in Lincoln. So I've been speaking to Paul Carrick, who's the city neighbourhood manager, and they've set up a special testing site at the Lincoln City Football Ground. And if people test positive, they have the lateral flow test. That's on the same site. And if that's not conclusive, then they get the inoculation. That started on Monday and is happening for 2 weeks. And then they're moving to another site early February on Monks Road. So I thought I'd just update everybody about what is happening in parts of Lincoln City. But I'm afraid I can't remember where the money's come from. But anyway, I just thought I'd give you the information I knew. Okay.
It's come from central government.
It hasn't. If it would be helpful, I can just pick up that point and give a little bit of an update on the Sinsel Bank issue, because it's hot off the presses. So yeah, Debbie and I were written to in December, and we put a bid into central government on behalf of the system, LCC led, but obviously with City of Lincoln and with Boston, to have 2 testing sites, one in Lincoln, one in Boston. Now, actually, it'll be 2 sites in each of those places, as Councillor Kelly's already pointed out, to offer asymptomatic testing. So this is testing for people who haven't got symptoms. and we use lateral flow testing, so it's a different technology. The hot off the presses data for this is giving us a total figure of on Monday, the first day it was live. It wasn't advertised because we needed to make sure we're up and running before we pushed it out more broadly. We had 58 tests on Monday and 1 positive. And bear in mind, this is somebody who had no symptoms. So this is somebody we would not have picked up in any other way. 1 positive. Yesterday, we did 282 tests and 11 positives. So that's 12 positives over 2 days that we wouldn't have picked up otherwise. Might not sound a massive number, but clearly those people may well be the sort of people who are going to pass it on, particularly to others who might be more at risk, because it's not their own fault, they just don't know that they have the disease. So really good work we've been doing as a county council with the 2 districts and with our delivery partners and with central government, and I'm really interested to see where this goes, but the data's starting to come through. We also have other models of providing lateral flow tests in other ways, which I can pick up at a later time as well. But there are 2 sites at the moment. There's a site at the football ground, as we said. 1 site in Boston will go live on Monday. Then there'll be another site in Lincoln and another site in Boston, and we will roll out as we go.
Can I just add that also people who are not able to, who can't actually get to the football ground, I think there is a door-to-door delivery service of self-testing kits. That's what I think has been currently worked on. So I don't think they could have done any more, really. I think it's excellent. Okay, thanks.
Just on that and what you said, Derek, in effect, the fact that people don't know that they've got it, have tested positive, is it therefore, because I think this is quite clear, it needs to be quite clear that a lot of people don't think they need to go for a test or shouldn't go for a test unless they're showing a form of symptom. But of course, if you've got a symptom, then you can test either positive or negative. If you have no form of symptom and you're a carrier, actually you should also go for a test, because actually if you are a carrier and test positive but have no symptoms, they are the people that we need more than anyone.
Yeah, the challenge there, Councillor Marthwaite, is that the national policy is you can only go and get a normal test. So you go on the government's website and you book a test if you have one of the symptoms. You can go even if you have very mild symptoms, but you can only go if you have a symptom, unless somebody like me in the council, one of the public health trained people, asks somebody to go for a test. We can do that as well. But the general approach is we can't test everybody because we simply don't have the capacity, and you'd have to test everybody every 2 or 3 days. So it's logistically just not possible. What we have done with the Sinsel Bank, the Monks Road and Boston areas is, you'll remember that middle of November, our rates were some of the highest in the country at a district level in Boston and Lincoln. And that is why we have applied for and was successful for the funding. We had to write the bid within 24 hours. So it was a massive undertaking for my team and the wider council, and then work really closely with the districts and with our delivery partners on it. So it was quite a huge amount of work, but I'm really pleased it seems to be paying dividends. The basic message I'd like to get out, and we are getting out, is anybody in that area who wants to go and get a test can go and get a test. If you have symptoms, please don't come and get a test. Book yourself a test online, and you can go to the Lincolnshire Showground, or you'll get a home testing kit. There's other places. If you have symptoms, you should be going. This is for people who don't have symptoms, but either want to maybe wonder whether they've got it, or maybe think they were in close contact with somebody who might have had it, or are just interested. Go and get a test. We can do it, and the results will come back within the hour.
Excellent, thank you. So I've got Rob Kendrick next, and then Marianne.
Thank you, Chairman. Derek, thanks very much for the report. It's obviously very interesting. Can I just ask you a question about the graph on page 154, which is obviously looking to the future, which is what it's nice to do. I was just wondering, there's sort of no indication on the bottom line of the sort of time scale for that. I appreciate it's a sort of model or a prediction, but is there any sort of modelling that shows a predicted time scale, assuming obviously I suppose there's so many variables such as how effective and how quickly the vaccine programme gets through. I was just wondering if you've got any thoughts on that, Derek. Thanks.
Thank you, Councillor Kendrick. I think that the reason we don't have any timescales on there is because of all the variables that are flying around, not least of which national government policy, specifically around lockdowns, is really important in terms of driving infection down or chopping the top off a peak, which, fingers crossed, is what we are seeing nationally, and certainly from a Lincolnshire level we've seen over the past few weeks. We've flattened out our rates. So I can't give you a specific time. What I can say is that because of the vaccine rollout and the Prime Minister's ambition to make sure that we get everybody in the top 4 cohorts vaccinated by the middle of next month, that will have a significant impact on deaths from COVID, and we should start to see some wider benefits in terms of the number of cases across the country. And by Easter, when we go through all of the top groups in that Joint Committee of Vaccination and Immunisation groups, so that's right the way down to 50s and above, including anybody who's got an underlying health condition, there will be 3 things that I think will be fundamental game changers. One will be that vaccination programme. If we have got that many people covered, not only will have a really significant impact on mortality, it will have a big impact on hospital admissions. It will have a beneficial impact on wider transmission. So we will start to see something called vaccine-based herd immunity. So not natural herd immunity, it's vaccine-based herd immunity. Big distinction, really important one to make, but it will give us some benefit. So that's point 1. Point 2, spring. Spring will help. We know that the virus doesn't like spring. And third, if we carry on the way that we're going, we'll have reasonably low figures going into that period as well. So those three things together, I think, will make Easter even more so a time of rebirth, renewal, and new hope, if you like. And as long as we stick by the rules, that's where I think we'll be. So if I'm going to be pinned to a timescale, I think the middle of February is really important to see the outcomes of the vaccine, but Easter will be particularly important because we'll have rolled out the vaccine far more significantly, and spring and other things will start to be in our favour.
Great, thanks.
Excellent. Thank you, Marianne. And then I've got Chris and then Liz.
Thank you. First, I love the idea of asking people for a test and then vaccinating them if they're negative. That sounds to me like a very good idea. If we've got, if you think about the elections, we are expecting the whole population to pass through go in a day. And actually, can we not do, I guess it's the supply, but if we can do that with, elections, can we not think about how that might be done with the vaccinations? I gather there are 3 now vaccinations that are available. And, is it supply? I know they say it's supply, but is it, can that, are you convinced by that? Is that something we should be pushing for? And how are they getting on with it? And then a thank you for, I see we've got very good vaccinations going at a great rate in Navenby and in Mears in Grantham for residents in my area. And I've been getting good feedback about that. Very quick, very efficient, and don't arrive early was the other point. Otherwise, you're mixing with people. So that was very. So I'm pleased to see that happening, because that's the test, the litmus test on the ground for us. The question is about care staff. I know we were behind in getting the PPE, and I understand in hospitals the staff are tested twice a week with a lateral flow, even though I gather the efficiency of the lateral flow is, you probably miss 30% of cases. I was reading, I don't know if that's right, but that's what they say, and depends who's doing the test. But, are our care staff getting a fair crack of the whip, same as the NHS? Thank you.
Thanks, Councillor Overton. So let's talk about the vaccine first. Vaccine programme is run by the NHS, and we have been working really closely with our local NHS, but we haven't yet got all of the information we would ideally like, that I would ideally like, but we're working really closely with them. In terms of vaccinating people when they come for a test, the Joint Committee on Vaccination and Immunisation has created the tiered structure, and that is based on the risk that individuals have if they catch COVID. Now, I completely understand the logistics of your argument, but the key priority is to make sure we go down that list to 50 and above, including those who have underlying clinical conditions, because that's where we will get the most benefit in terms of protecting individuals who are most likely to unfortunately die or need hospital treatment if we don't do it. So that's why that list is that list. Absolutely clear that we should stick to that list. I agree with that position, having read all the background papers from the JCVI. Although, notwithstanding, if we've got a vaccine free and we haven't got somebody in that group, we should vaccinate whoever we've got. But there is a fantastic call and recall process that we have in the NHS to vaccinate people. We do it with childhood vaccination schedule, we do it with flu vaccination every year. So we know what we're doing, and that is rolling out. So that's the reason why it's being done in that way. In terms of testing, the lateral flow tests, the short answer is yes. Care staff, social care staff do get the same testing regime if they're in a care home. They get both lateral flow test and the gold standard, the PCR test. So that's part of the national scheme. We are working with central government to make sure we get lateral flow tests into the council, and we can test our frontline staff whilst we wait for them to get their vaccine. So that's being worked up now. We're already doing it in some instances, but a lot of this needs standard operating procedures, clinical governance processes, and despite what you might see on an announcement in the government, that's the headline. There's an awful lot of detail we need to work through, and Lincolnshire has been and will continue to be at the forefront of this. We are currently working with government on a pilot around test to enable that doesn't exist anywhere else, and again, we're on the front foot. We're one of the first places, if not the first place in the country, who is looking at how we can do this. So there's lots and lots of stuff going on. Doesn't take away from the fact the more that we can vaccinate people. So my message to everybody is, if you get offered a vaccine, please have it. Your healthcare professional will be able to talk through any of the contraindications, any of the side effects, but generally the two vaccines that we have at the moment, so that's the Pfizer vaccine and the AstraZeneca Oxford vaccine, are very stable. They seem to be doing a really good job, and even after just one dose, you're getting between 80 and 90% immunity from that one dose. And it is likely that immunity, we haven't got the data yet, but it is likely, based on other knowledge, that immunity will last for at least 6 months. So the fact that we've stretched out the time between the two doses, again, I completely support that approach, because being able to vaccinate 2 people and get them up to 80-85% immunity rather in that window, rather than one person and get them from 80-85 to 90-95, is a much better protection from a public health, population health perspective. So I agree with that. I think there's a lot of questions in there, Councillor Overton. I've tried to cover the headlines. Happy to pick up more. And I know Cackley attended one of your meetings last week to hopefully cover some of that as well.
Yes, and thank you very much for the very helpful support. The community were hugely appreciative. We've got 13 COVID groups, so it's a very handy way of talking to quite a lot of people. So thank you very much indeed for that.
Brilliant, excellent. Chris?
Thanks, Chairman. It was just a quick question based on the letter that Martin and others sent recently about communication with the NHS on news sites and things like that. And just wondered if there'd been any kind of progress on that. I mean, I know know yesterday they announced 5 more vaccination sites, and I know for experience that they did give the local MPs got a half an hour heads up before that went live. But I was curious if there'd been any sort of progress on that, or because it does seem that other areas have been a bit, in case, I mean, Norfolk's one that keeps being brought up, where there sounds as though they're a little bit more communicative there, the local NHS. So I was just kind of wondering if they're any further forward with that, or to be fair, if you're aware that there's going to be a much larger spread of vaccination sites now, because I know obviously a lot of the county is now covered, but there'll be the odd spot that isn't. So yeah, they were the 2 kind of questions on that rollout, if possible.
Thanks, Councillor Reid. We continue to push to get as much information, as much data as quickly as possible. It is hard work. I mean, Scrutiny will remember my frustration last spring and summer with trying to get any data on testing from the central government. It was a famine, and then all of a sudden it was a feast. I get the feeling the vaccine rollout might be somewhat similar. My understanding is all of this is controlled nationally, so it's not a local NHS issue. It is a national issue where the decision has been made that the data will not be shared outside of a very, very small number of people. My view is, for me to do my job and discharge my duties, and for you to hold me to account for doing that, I need to understand who's getting vaccinated, because generally we need to tie that into, well, who's being tested. If we get an outbreak in a care home, at the moment I don't have any idea how many people in that care home have been vaccinated, apart from by asking the people in the care home. And things like that don't make any sense to me from a population health management perspective. But it's not a local NHS issue, it's a national issue. We continue to push as hard as we can. In terms of the overall vaccine delivery model that the NHS have, and for Lincolnshire, we've got sort of 4 components. We've got the 2 hospital hubs now. We've got 13 sites across Lincolnshire that are based on the primary care networks that will be delivering. They will all be up and running by the end of this week. We will have 2 bigger vaccination sites in the county as well, and then there will be a roving model for those people who can't get into the sites. And we're working with the NHS on that in terms of trying to provide transport and other support services to get people to those sites, because clearly it's a much more efficient model if we can get people into a site where they are set up and can get people through a conveyor belt type process than it is going out and having to vaccinate somebody in their own home. But that's not to say we won't do that, or the NHS won't do that, if that's absolutely the only way to do it. So we're doing everything we can, but it's hugely frustrating to me.
Excellent, thank you. I've got Liz and then Christine.
Thank you, Chair. Hello, Derek. Thank you very much for this. I'm just concerned myself about the availability of the vaccine. On a personal, I know this from a personal reason. My mother was rung 91 2 days ago to say to go to Springfields on Saturday and have her vaccine. She was rung again yesterday to say, no, don't go to Springfields on Saturday. They won't have the vaccine for her. So, is this going to be an issue? Now, my mother is saying she'd rather that her granddaughter, or one of them, for example, my daughter who teaches, had the vaccine than herself. I know you can't chop and change, but she stays at home. She doesn't have to go out where my daughter is facing a class every day. And, I just wonder whether, that's a side issue, but are we going to find that the vaccine there's enough supply of the vaccine to carry out what we need to do? Thanks.
Thanks, Councillor Sneed. We have been given assurance by central government that there will be enough vaccine. Now, that's at a UK level. There will always be, for logistical reasons, supply chain reasons, lots of other reasons. On any given day, unfortunately, it'll be a bumpy road, and we may have people booked in, and we may not get the vaccine delivery in that one site. But we've got no indication, I've been given no indication at this point, that is a persistent or recurring issue in Lincolnshire in any of our sites. So completely understand that, from a personal perspective, my mum's got her vaccine due on Saturday, This is in Liverpool, and their rates are going really up. So I'm very keen that she gets it, but something might happen, and the location might not have it. Is to rebook, is to make sure if you get offered the vaccine, you get it at the earliest possible point. Completely understand, again, from a personal perspective, you know, my mum would want my sister to get it because she's out and about more. But the risk is to my mum, the risk is higher to my mum. So we go back to the JCVI and this science, and the science is age is the single biggest predictor of death or needing hospital treatment, and so that's why we're going to do that. So I would advise your mum, please get a vaccine.
She will.
The quicker we do that, the quicker we can get to everybody else.
Thank you. Thanks.
Okay, thank you, Christine.
Good morning, Derek. We've bet the farm on vaccines. Viruses mutate. How confident can we be? We've already got 2 variants that we know of. There may well be more. How confident can we be that the vaccines at present or oncoming ones can be tweaked to cope with the new variants? That's the first part of my question.
Shall I answer that one? Thanks, Councillor.
Yeah, just to sort of, save me having nightmares about this. Would be good.
Excellent question. The evidence that we've got, and I'll say again, we're only about a year after this virus was originally discovered. The evidence that we've got is that, regardless of the variant, the vaccine will work, because vaccines don't just target one thing. So on the new variants, there's different parts that have changed. One key part is the spike gene, the S gene. That has changed, but all of the work that's been done by Public Health England and Porton Down, which is one of the best lab systems in the world, is suggesting that it won't have a significant impact on the efficacy of the vaccines. Now, that's not to say we won't get a variant that does, because viruses, quite rightly said, do something called vaccine escape. They will evolve to try to escape the vaccine. Coronaviruses tend not to mutate that quickly. The example I've been given is, if you think of the flu is more like ivy in terms of its rates of growth, you just cut it back and then 3 weeks later it's already coming back. That's how quickly the flu can mutate. Coronaviruses are more like cacti. That's the rate with which they change. Now, the reason this one's changing more quickly compared to what we would have thought is there's so much more of it around.
Yeah, of course.
Once we get the rates very low and we get vaccination out, we are then likely to see a slow rate of mutation. That doesn't mean... Yeah, so we've got to keep our rates low. That's the fundamental point. We've got to stick by the rules, keep our rates low. If we do need to adapt the vaccine, it's highly unlikely we would need to do that this year. And if we do, some of the technologies that have come on, for example, the Pfizer vaccine, I think is an mRNA vaccine. So it's a new technology, and it's faster and I'll say more straightforward. I don't underestimate how technically challenging this is, but it's more straightforward than normal vaccine changes. So all of the science is saying we will be able to adapt our vaccine, just like we do with flu, which mutates to make sure that we keep up with this. And what will happen is this particular coronavirus, SARS-CoV-2, we may never get rid of it, but it just be a mild annoyance for the vast majority of people, just like most colds are.
Thank you for that. Just a couple of things. And one thing that does strike me, we've always thought in this country that Porton Down is a very sinister sort of place. It's always been with those, those dreadful sort of poisons and chemicals and things that that could be used against us. And now we're thinking of it quite rightly as a lifesaver. And it's just interesting how the persona of Porton Down has changed dramatically, which is an excellent thing. My only other query is, what do we do about those people who've had booked jab sessions and who don't turn up? I mean, especially important with the Pfizer one, which cannot be kept. And I understand that in some places, nurses are saying, would you like it? We've got it here, use it or lose it. What sanctions can we have or insist that people do keep these appointments that are booked to avoid waiting? I just worry about that.
Yeah, I think the key point is we really want people to turn up and keep their appointments if they're booked in. I don't have that data. It's another one of those gaps in data that I would love to have, but I haven't got it. What I have got from the senior responsible officer in the CCG is that we are not seeing any significant level of that behaviour. The vast majority of people
That's good.
are really taking on board their invitations, are turning up and are getting their vaccine. I think pragmatically, as I said earlier, if we are aiming to vaccinate an 85-year-old with underlying health conditions, but for whatever reason that person doesn't turn up, if we've got somebody else that we can vaccinate, and that's just a pragmatic approach. But the process there, I think, is a question Scrutiny may want to ask the NHS, because they'll be able to give you the detail. I just don't have it, I'm afraid.
Well, I won't hold you responsible. Thank you very much indeed. Thank you.
All right, thank you. Well, I've got Mark and Rob Folks to come back. Mark.
Yeah, thanks, Mr. Chairman. From what you're saying, Derek, I'm getting the impression that is the sort of vaccination process going to be a recurring annual thing, that, like the flu vaccine is given annually, people will have to have a COVID vaccination annually as well? Or do we know if it's more like some of the vaccinations we had as children, which gave us a lifetime immunity? Thanks.
The short answer is we don't know, and anybody who says they do is is either a genius or is maybe hedging their bets a bit. I don't know. If I was a betting man, I would say that once we've gone through this round of vaccinations, I don't think this sort of virus generally will need an annual vaccination programme. It's not like the flu, but I might be wrong. But if I'm wrong, that's fine, because we have a flu vaccination programme, and as long as we have a very low level, and you remember we were in single figures, we were 2, 3, 4 per 100,000 infections in the summer. We'll be lower than that once everybody's vaccinated and we're back in the summer. If those are the figures, it then becomes we will vaccinate the most at-risk people because of lots of reasons. So personally, professionally, I think it's unlikely we'll have to have an annual COVID vaccine programme, but we will wait and see.
Thank you. Rob?
Thanks, Hugo. Derek, this is a question about the spread of the virus, and we're encouraged to wash our hands, wear face masks and keep social distancing. But I've noticed when you go to the supermarket, in our local Lidl store, virtually nobody is washing their hands when they go in. They provide the gel stuff and sort of paper towels you can wipe the trolley handles with, and people just wander in and ignore that. And I know that Morrison's and a few others in the news have said they're going to make it compulsory to wear face masks, but it seems to me that the most important thing is to wash your hands. So I'm not sure if that's right or not, of course. So between washing hands, wearing face masks and social distancing, which is the most critical one to reduce the spread of the virus?
So at the moment, Councillor Folks, none of those. Stay at home. If you are in your house with the door closed, you're not going to catch coronavirus unless you allow somebody into your house. So that's the first thing I'd say. But generally, after the stay, and bear in mind, this is in legislation, you are legally obliged to stay at home unless you meet one of the statutory exemptions that allows you to leave your house. So stay at home. That's not to say you shouldn't. In fact, I would say you should go out once a day for some exercise, ideally in the daylight hours, because you'll get a little bit of what sun we've got at this time of year. It's important to get out and get some fresh air, but you must stay at home. So that's point one. Point two, hands, face, space. You're absolutely right. They're the next most important thing. That will stay the same right the way through till the summer. Coronavirus, as it is, cannot get through your skin. So the key challenge there is, if you aren't washing your hands, you have to make sure you're not touching your mouth, nose or eyes. The easiest way to not worry about that is to do exactly what you said, is to use the the hand gels, because that will kill any virus that happens to be on your hands. So it's using all of those. Keep your 2 meters plus. Really interesting that the government seems to have gone back to the narrative of 2 meters plus. I never went away from it. I always said 2 meters plus. Keep your 2 meters plus.
How does that work, though? What's the mechanism for catching this virus? I mean, at what point does distance, render you invulnerable to it?
Well, I mean, there is no perfect solution, but coughing and sneezing. And it's about the viral load you receive. So if you are within 3 inches of somebody who is coughing and has the virus, you're going to get a big old waft of it that you will inhale through your respiratory system. And that is a very high risk process. If you are 3 meters away from somebody who happens to cough as you walk past, the particulates there are so dispersed that you're getting, if you get any, you're getting a very, very, very low viral load. So it's hard to give a definitive, but I have always been, from reading the evidence as it emerges, if you stay 2 meters plus and you're not close to somebody for any length of time, you're really minimising your risk.
I think the best way I think of identifying it is if you stand next to somebody that smokes a cigarette, you will smell it. If you stand about 2 meters away, you will not smell it. And actually that just highlights, cigarette smoke highlights how particle moves. And if you stand in the right wind direction, you're even better. And so it's sort of, but yeah, it's amazing how people sort of forget that element. So, but yeah, distance is key without a shadow of a doubt. I only think the one thing I would like to see more, and is actually disinfectant gels on the way out of the supermarket. As I've touched everything, I'm clean going in, but then you touch everything, and then it's like, and then I wanted to disinfect my hands once I dropped the trolley off back before I got in my car, and I had to then go back on the entrance, then come against the flow to get back out because of the one-way systems. And you think all I want is, well, perhaps should have it in the car, but anyway, it's
yeah. Keep it in the car, Hugo.
But okay, well, I think that's everybody. So. Derek, you've got to go in 5 minutes. Is there any other sort of update that you just want to give?
Yeah. Would you like me to just give you a quick update on the current situation across the county and compare that to the national position? So as of 4 o'clock yesterday, these data, I'll give you the national data and then I'll give you my local data, which is a bit more up to date. The national data is saying that in the 7 days up until the 7th of January, the national rate is 630 per 100,000, and Lincolnshire's rate is 287. So we are less than half, and there are a large number of places that are over 1,000 per 100,000 in the south and the southeast. So we are significantly lower than the national numbers. No room whatsoever for complacency, but I think that's a positive. The more up-to-date data that I have, which is up till the 10th. So it's a couple of days out of date, suggests our rate's gone a little bit lower than that. So we're about 257 per 100,000. A couple of key points that we've got, because we have the data now and we analyse it in a very detailed way. Our over 60s rate is lower than our overall rate, so it's less than 200, which is great, because that means we've got less infection in our older people, which means hopefully less onward movement into hospitals, and we've got significantly lower rates in our children 4 to 16. They're less than 100 per 100,000, and of course the school situation will be driving some of that. So of our lower rates, the majority are in the working age population. So my ask to everybody really is, if you can work from home, please work from home, because that's how we'll bring that bit down as well. So that's the overall data really. For those students that have had to return because they're doing face-to-face courses, we've got very low levels of infection because the universities are continuing to test in the same way as we're testing in the Sinsel Bank area at the moment, and are finding only very small numbers. So not a huge issue at the moment. So overall, from a Lincolnshire perspective, all the evidence is suggesting as we've done right the way through, the people of Lincolnshire are sticking by the rules and we're keeping the rates low. The more that we can do that, the longer the better. We'll keep our rates low, we'll roll out our vaccine, we'll start to get lighter days, we'll start to get warmer days, and we'll start to really get on top of the virus.
Fingers crossed.
Excellent. Yeah, well, thank you very much for that, Derek. And I think your report's very good. It gives a snapshot, and I suspect next year you'll be doing a real follow-up of everything that hasn't happened and we've missed because of the pressures of COVID. And I mean, it'd be interesting as well, because the one thing of staying at home, that prevents a lot of falls, especially in this icy weather and things like that. And it's all those little bits that must be also taking pressure off the system. Yeah, and flu's got to be down because people aren't seeing each other as well. So
I would say, though, I absolutely agree with you, Councillor Marfleet, but what we need to remember is the NHS is still open for you if you need it. But clearly, going to NHS 111 online is a really good source. Phoning your practice, if you've got a hospital appointment, phoning ahead just to make sure it's still going on are all good ideas for the general population. Yeah. But the NHS is still there, and I think because Lincolnshire people are doing such a good job of following the rules, we will hope to maintain some capacity. If we don't, and we start to fill up every bed with COVID patients, it means that if somebody does have a slip, trip or fall and needs a hospital bed, it might not be there. If somebody of working age who's fit and healthy for every other reason is unlucky enough to be in a road traffic accident, the NHS might not be there for them if we don't stick by the rules. So that's why staying at home and hands, face and space when we're not is absolutely vital.
Yeah, so excellent. Well, thank you very much, and keep up the good work. So
don't call your review a post-mortem, Derek, that's all. Sorry about that.
But right, well, we just need to nip back to item 7 because I need to get a proposer and a seconder. I jumped through that because I was busy looking at the main pack agenda and then missed the briefing note. So can I have a proposer for the Hoplands Care House? Liz, thank you. Yeah. And seconder, Christine.
Thank you very much.
And all in favour. Oh, that's it. All put your cameras on and all in favour. Put your hand up. So brilliant, unanimous. So
that sort of day.
That'll do. But right, and now we'll jump then to I think we're item 9 then, aren't we? Simon, work programme.
Yes, thank you, Chairman. On page 158 to 159 of the pack are the items for the February and April meetings. There is one further item to add to the list for the 24th of February, which is the pooled budget and lead commissioning arrangements for learning disability, mental health and autism, which is planned as an executive decision at the beginning of March. Thank you, Chairman. There are no other changes.
Okay, brilliant. Thank you. So February is busy. April is, in a sense, in the if the election is running, which it could now be delayed. We perhaps just need to look at that one and think, because we might be in full throttle mode still if the election's delayed, or we might be in purdah and therefore tread carefully. So, but I think maybe that might be one to just sort of float in there is, just a sort of final recap on some positive areas of new ways of working through the COVID. That really doesn't really fall under purdah. Well, doesn't have an impact because of purdah or anything. And we can just sort of finish on a sort of a positive note for the session of the committee. Any views, Christine? Do you want to speak?
No, thank you.
All right.
Yeah, hand's still up.
So,
I beg your pardon. I'm not familiar with the.
I know.
how does that sound for April?
Yeah, and who knows? There might be other things come forward, mightn't there, in the next few weeks? Everything's so fluid. But yeah.
So okay, well, we'll just sort of, I think, have something along those lines, Simon, sort of potentially to sort of.
Yeah. Okay. Thank you.
Finish off on. All right. Well, thank you all for coming and or turning up on the screen. Perhaps a better way.
Yes.
And have a good day and see you soon.
Thank you.